I'm sorry.
You are live to air.
Okay, we're going to start calling the meeting to order. To call the meeting of the Emergency Policy Group to order to update on coronavirus. I think we all know why we're here. Before we get started, we want to make sure that everyone keeps their phones on mute until they're ready to speak. And when you're ready to speak, please let me know. And when you're called upon, please identify yourself. Please give your name so the clerk can record who's speaking at this particular point in time. I'm going to ask the clerk to please call the roll.
Good afternoon, everyone. Miller?
Here.
Overman?
Here.
Berman?
Here.
Cronister?
Here.
Castor?
Here.
Ross? Snisley?
Here.
All right, you have quorum.
Okay, thank you. Also, be mindful if there are any votes to be taken today, there will be a roll call vote for any votes that's going to be taken today. First, I'm going to call on the Hillsborough County Office of Emergency Management Director, Mr. Tim Dudley. Mr. Dudley, you recognize.
Good afternoon. I'm Tim Dudley, Hillsborough County Office of Emergency Management Director. I'll provide a quick update on current operations. As of 11 a.m. on March 23rd, Florida Department of Health reported 1,171 cases of coronavirus in Florida, with 14 resulting in death. In Hillsborough County, there are 73 cases, including 68 residents and 5 non-residents. Their ages range from 6 to 79, with an average age of 40. No cases has resulted in death in Hillsborough County. 2 have recovered. Our current objectives are to finalize preparation of identified collection sites, establish wraparound services to provide feeding support to persons in home isolation, establish wraparound services to provide support to persons in county-managed quarantine and isolated locations. We are working to finalize preparation of donation management sites, and we continue to coordinate logistics, receiving, and staging areas for critical supply lines. The county staging area is designated as Mosey. We will continue to prepare for alternate care site operations, and we will continue to provide relevant and timely information to decision makers and stakeholders. I would also like to remind the EPG members of how important it is that we all approach this event as a community event. This completes my update.
Okay. Any questions of Mr. Dudley? Since there are no questions, I want to do something before I call on everyone. I'm just going to call and see if the presenters are here. I will call you later to make your presentation. Is Dr. Holt on the phone?
Yes, sir, I am.
Okay. Is John Couris on the phone?
Yes, sir.
Tom Inzina?
Yes, I'm here.
Okay. Ravi, Chari?
Yes, I'm here.
Beck, Shultz?
I'm here.
Dr. Donna, Petersen?
I'm here.
Dr. Marissa Levine?
I'm here.
Okay. Very good. Before we go any further, I think there's something I need to say and put on the record that we all need to abide by. Hopefully, we can agree to abide by these. I think they're essential for us to go forward. There are 3 central themes that I want to cover. I want to call the 3 C rules of engagement. One is coordination of equipment, supplies, and activities. Each partner must share information and resources in order to preserve the community good. Chaos results when intel is not shared, regarding supplies, equipment, and personnel. For maximum effectiveness, all partners must be open to working together. This doesn't always mean partners will agree. However, once a decision is made to pursue specific plans of action, all partners must fully and cooperatively engage in achieving those plans. Second, the collaboration on achieving defined goals. Working together is much more productive than one partner attempting to do all of it alone. Our team must collaborate effectively if we are to maximize the impact of scarce supplies, equipment, or personnel. Uncoordinated efforts lead to duplication of effort, waste precious supplies, energy, and time, and keeps us from achieving critical goals. Working together is paramount for our efforts to be successful. And lastly, communications. Communications to the community and between partners on goals, activities, and actions must be taken. In addition to coordination and collaboration, we must ensure we speak with one voice so that the public does not get confused or misinformed. Communication between partners during an emergency always is best done via a recognized chain of command. Multiple voices using too many channels to convey information is a recipe for chaos at its best. And I hope that we can just remember the 3 C's as we continue to go through this pandemic. It's vital that we continue to do that. I just wanted to put that out there and hope that each one of us could share this and understand what we're trying to do and where we're coming from. Dr. Holt, you recognize for update of the health department.
Yes, sir. I won't repeat all of what Director Dudley said, but we do have 73 cases. We've been fortunate. Most have been mild, moderately ill. Less than 10% have been over 60. The majority of testing that we're seeing and positive results are coming from the non-public sector. The best way to stop this virus is to focus on someone who's infected and who is most likely to become infected, because clusters, whether they're family, friends, or where they work, are the predominant transmission. I've listed and update on the priorities that we have been focused on. Social distancing. I think we've made great progress in efforts, but there may be some more to go because we must continue to stop transmission and limit human interaction. We must continue to persuade our public to stay home and convincing them this is the right thing to do for both themselves and others. Personal responsibility, as we've emphasized in the past, do their best to stay in place where they can, remaining 6 feet apart if out. Clusters are our new public health focus. We must rapidly identify a case and any secondary cases, isolating those who are infected and watching those who have been exposed. Ideally, we are keeping people in their homes, but increasingly that may be, it's not ideal because many are unable to either leave their homes or they don't have separate bedrooms and bathrooms, so the risk of transmission is increasing. It could become a problem. As I've mentioned, I think in the past, protecting our most vulnerable is what I worry the most about. We've made progress, at least on developing a rapid response team for our nursing homes and ALFs, so we can quickly look at a case of potential COVID-19 and diagnose it and deal with the consequences. Protecting the healthcare systems, facilities. Our hospitals are already responding. They've been leaning forward, implementing triage areas, lockdowns, if you will, for visitors and others. So they've been they try to evaluate these influenza-like illnesses outside of their emergency department. As we've seen nationally, New York City is under stress, and internationally, Italy is in much worse shape. Last, in addition to link to this, trying to develop, working with our community again to develop a system that we can triage and actively manage those who are most vulnerable to disease. If we see a surge in that population getting infected, we must not overwhelm the facilities and have potentially alternate care sites or other things for them. And then finally, our access to testing, guidelines we're trying coordinated in a very safe way, focusing on those who are ill, but certainly our high-risk groups, nursing homes, healthcare workers, and first responders. I'll stop there, sir.
Are there any questions of Dr. Holt?
I have
Any
a question, Commissioner Miller. I have a question. This is Melissa Snively from the school board.
Okay, you recognize?
Thank you, sir. I have actually 3 questions based on what Dr. Holt mentioned. I wanted to clarify what a non-public sector is defined as he mentioned the 73 cases. Out of those cases, the majority have been determined to come from not the non-public sector. And then also of those 73 cases, have they been determined the exact sources of the transmission, where those originated, and what's the Department of Health strategy for identifying people these infected individuals have come across and quarantining those people to stop further transmission?
Yes, ma'am. I'll make sure I get them all. I mentioned about the non-public. That's really where our ramping up our physicians in the community or the hospitals are now doing either local testing at their facilities and/or doctors are ordering tests that are being sent to the commercial labs, Quest and LabCorp. That's just it indicates that both the limited capabilities that the public health or my system had, plus some of the restrictions, but mostly the limited capacity is now being taken over, if you will, or augmented, and I think we're beginning to get a greater sense of the amount of virus in our community. As far as the number that have been identified, they are divided into really risk factor associated with our mostly the travel initially in the outbreak, where we saw other countries and international cruises, and now even if they're connected to New York, Washington, California, or some others. I don't know offhand, but I can get you the exact numbers. I think well over half, but the predominant amount of those was in the first half of our cases. What we're seeing now is as the community is doing more and more testing, that linkage is not identifying a source. People, we know they tell us, and that leads into, I think, your third question, which is we do an aggressive public health investigation of every case that we're notified. We ask the person basically for 24 hours or so, depending on the situation, prior to them becoming symptomatic, not when they're tested, but when they became ill. Basically, we try to walk through every hour of the day that they have spent. Who have they been around? What kind of circumstances they were? Do they know anybody that was a week or two ago that were ill? That gives us a possibility of finding the source. Those contacts that we identify, those that they have been around, are categorized into 3 categories: high, medium, and low, based on CDC guidelines. The high or highest risk are required, and we check on them every day. They are staying in their house and are well. The medium risk are managed through a self honor, a little more honor code, if you will, staying in their house without our more aggressive confirmation, but we do check on them daily to find out if they've become ill. And then lastly, the low risk that we quantify are advised to take all of the personal protective steps that we now advise all of our citizens and community, but at the first sight of our first concern of any illness, to notify us. All 3 categories, anyone who's ill that we become aware of, that we're checking with, are promptly routed through the public health lab system, which is now my focus, because I think I mentioned last time, we're probably, each case, there's a range of number of people that we identify in contacts, high and medium. They they can range from 5 to 100 people depending on the situation. So it's a lot of people we're sort of keeping an eye on, or they're helping us out. I hope that answered your questions. I'll stop.
Yes, thank you very much.
Any other questions of Dr. Holt? Any other questions of Dr. Holt? Dr. Holt, thank you very much.
I have a question, please.
Who is this?
I have a question, please, Dr. Holt. This is Commissioner Overman.
Who's speaking?
Overman,
Okay, Commissioner Overman, you recognize.
thank you. Dr. Holt, you had mentioned earlier in your presentation that the clustering is something that you're paying attention to, whether it be families, workplaces, or things along those lines. You know, we're mobilizing to minimize transmission of this disease through social distancing and travel restrictions, and looking at possibly a safe stay-in-place situation. But it's becoming clear that progression is a function of demographic composition of population. And Commissioner Miller mentioned earlier the importance of coordination and collaboration and communication. This may be covered under the USF School of Public Health discussion, but what data is being shared among the groups when it comes to ages and, say, family structures, comorbidity? Those things are critically important to share among ourselves in order to focus on prevention and preparedness. So if you're collecting data about age, are we sharing the data of family groups, family structure, occupation, things that would indicate what population is greatest at risk of transmitting the disease or acquiring the disease, so that we can best prepare how to adopt policies to protect our citizens?
Yes, ma'am. We share data or create data on an aggregate basis that is rolled up into the state, and I try to present locally at this meeting what I know about our cases, age and gender, and some others I can give. The other details about where someone works or an employment or anything like that, much of that is actually getting out in the public, because some of the places that are being that identify a case or have a case have shared that with a variety of different things. But I am not allowed to provide specific information on any individual case. The most important data that probably we will become necessary for us to get is maybe from our healthcare providers, because we generally don't do a detailed medical history on the individuals as long as they're well or they're feeling okay. Since we're going to call them up every day, we monitor them to see if they are feeling okay. And let's see what else. So that information, certainly if we found something that would need to be actionable for the public, such as someone might have been at this type of location and we felt that risk was high enough, we certainly would do public. But that's the only situation I can think of that we would individualize anything that would, as what I understood the question to be. I'll stop there.
Okay, any other questions, Dr. Holt?
The reason I asked that question is because if our policy is to keep our children at home for the next month, which is what we've done so far, and we have seniors that are actually babysitting for our children. So you have the demographic between the cases we've seen of age 6 to 79. If our policy is to keep the kids home, we may have a real problem with cross-contamination across families, which will put great pressure when that person gets sick, and now we've got a whole household sick. And that is going to make it very difficult for our medical professionals to be best prepared for a widespread contamination.
Dr. Holt, you want to address that or not?
Yes, ma'am. Or yes, sir. The ones we're under observation so far, the known cases, we have, they've been remarkably compliant, and I'm superstitious, I shouldn't say this, but we have not seen secondary transmissions to date. But the history, what everybody else has experiences across the other world and country, that's what you should expect. I think what we're all concerned about is the ones that are people who are infected but we don't know about, and that's why those social distancings are so critical. And as you mentioned, anyone around our elderly, no matter what, should be super cautious. And homes and social situations often put parents and others in a difficult place where grandparents may have to sort of step in. And I think I understand your concern. I'm not sure how the policies would impact up pro or con, and maybe later the public health people could give me a better answer.
Okay, thank you, Dr. Holt. Let me remind everyone, please put your phones on mute. We're getting some feedback because someone's phone is not on mute. Please put your phone on mute until you recognize to speak. Okay. We're going to now move into collection and testing site status. Mr. Merrill.
Yes, Mr. Chair. Where we are currently is that the Raymond James Stadium collection site will be ready for Wednesday. We just received in the last couple of days 900 collection swabs from the state of Florida, and those are currently at the PSOC, at the Emergency Operations Center. We continue to actively push the state for additional kits. 900 is a good start, but we certainly need more. In the meantime, the private hospital and healthcare providers who you'll hear from in a moment have been conducting collection and testing through their existing facilities. So the Raymond James site would be an opportunity to expand testing, and eventually, if we get additional testing kits, collection kits, more of that workload can be shifted over to the Raymond James site. The thing we're still waiting for, which the state has said is en route, is the personal protective equipment, the PPE. We're supposed to be receiving that either today or tomorrow. We are not able to open the Raymond James site until we have the protective equipment, even though we have the collection swabs. PPE in the community among healthcare systems and among fire rescue departments is limited, and so it's not feasible to be able to share that equipment. So we're talking about special masks, gowns, gloves, protectors, and so forth. So as soon as that PPE arrives, we can open up the Raymond James site. However, I do want to make it clear that 900 collection swabs is not a lot, and it's very likely we will go through those in a day or two. The way that someone gets tested or gets the sample collected at Raymond James is to call a central call center number, which will be published. When they reach that call center, there will be a registered nurse or other trained professional on the other end of the line who will screen them according to the specifications of the Department of Health and only those who meet those criteria will be given a number or an authorization to go to the Raymond James site. So it's not a site that's open to the general public to just show up and drive through. So I think that's really important to understand. The setup and the preparation of Raymond James site has been a cooperative effort between the City of Tampa, the county, and the private healthcare providers that you're going to be hearing from in a moment. The staffing of the collection site will be by the healthcare providers, and the actual support, traffic maintenance, and so forth will be provided by the city and the county. So with that, I'm going to open it up and give an opportunity for the CEOs of the 4 healthcare providers to tell us about what it is they're doing, both in their own private networks and with respect to Raymond James. And we'll start with the order that's listed in the agenda. So first is John Couris, who's CEO of Tampa General, TGH Tampa General Hospital. John?
Mr. Couris, hold on. Mr. Couris, before you do that, let me make sure that when the roll call was called, the Merrill Lott's name was jumped over. He's on the phone. Merrill Lott from Plant City on the phone. So please put that in your record. Okay. Mr. Couris, I'm sorry. Go ahead. Go ahead.
No, thank you very much. Tommy Inzina and I, the CEO of BayCare, and I spoke before this meeting. He's going to lead us off on testing, and then I'm going to follow up with our position on the stay-at-home executive order that's being contemplated. Tommy, do you want to kick us off, and then we'll add in?
Thank you, John, and thank you all for giving us a chance to provide some input and have some dialogue as you're doing this really important work. As Mr. Merrill mentioned, to date, we've had a really good balance of public-private partnerships. Tampa General, BayCare, HCA, and Advent Health have had a number of discussions along the way and are working together. I'll describe the testing situation mainly to make your conversation more efficient than having a bunch of us talk. The plan has been just as Mr. Merrill described. The health systems would provide the support from a staffing perspective to operate the Raymond James site, and the logistics would be handled by the city and county. A big contingency along the way has been getting the testing equipment as well as the PPE, and so we're happy to see that we have at least some test kits, and it sounds like enough line of sight on the PPE that we could feel optimistic about it. So we are still prepared, if that's your desire, to help you stand this up. The way it would happen practically is some of us, probably mostly BayCare and Tampa General, Advent Health may be doing some. BayCare is currently operating several remote sites already. We operate a bunch of urgent care sites across 4 counties, and we have drive-through testing done there. So practically speaking, from a logistics perspective, it actually would help us move some of our team to the Raymond James site, because our urgent care sites are often small and they're in possibly strip centers with other businesses. And we've had a little bit of complaints from some of the other tenants in these buildings as we have cars go through that. So logistics of Raymond James is actually a helpful mechanism. Tampa General is doing something similar but different. Instead of drive-through, they've got a place they're funneling their patients to. Obviously, HCA and Advent Health, at a minimum, are having to do testing for their hospital patients. They have people that they're concerned about. I'm not sure of what they're doing from an outpatient perspective. So we've been doing that, and we would be prepared to migrate those people over to those sites to create one larger platform that would have some logistics associated with it. One interesting thing about testing is that from the time we all started this to now, depending on where you are in the country, the view on testing changes from time to time. When we first started, the focus nationally was test everybody you can. You've probably read that in some other communities where the virus has already overtaken the community, they've decided to pull back on testing and focus more on the acute patients. I'm a business person, not a clinician, so take my view for what it's worth. I think in our community, we still are in a place where getting a sense for how prevalent the disease is a good idea. And if we can do testing outside of hospitals, it would be a good thing so that we could keep some people who possibly have coronavirus but don't need to be in the hospital out of the hospital. One of the downsides, as Mr. Merrill pointed, is 900 tests, not very many. We have done at BayCare over 3,000 in the last week and are currently, over this weekend, we only opened 4 hours each day. And we average 300 tests on each of those days. So he's right. Even if you restricted it to 300 or so a day, what we have will only go 3 days. But that buys us time. We may very well be able to get more supplies until then. The only other thing I'll share is just something we need to all be aware of. That is, if we can't get more tests, there is a potential downside to creating a sort of a wide-scale communication to the community that we're going to do testing, and then we conceivably have to close it in a week. And I have had 3 arguments with myself about this. I disagreed twice, so I went best 2 out of 3. One argument would be we're better off not doing it if we have to close it in a week. The other side is that even if we have to close it in a week, we will have tested 900 people, which would be a good thing. So that's where we sit. We're absolutely prepared. We do see, because this was intended to be sort of led by the city and the county, supported by the health systems, we're very comfortable taking direction from you. If you want us to help you stand up the Raymond James site, we will do it absolutely as quick as possible. If you decide you don't want to do that, because we're currently doing remote testing, we can use the 900 test kits in another way. We would just want to make sure the state is aware of what your plans are. So I'll pause there and let any of my colleagues add additional information if you have, or we can answer questions.
Any other comments from anyone else?
No, this is John. This is John Couris. Tommy summarized it very well. TGH, along with everyone else, stands ready to stand up that center at Raymond James. Assuming we have the PPE that goes along with the 900 or so test kits. And our teams have been working very well together with the city and with the county on the logistics, on the systems, on the processes, on the general flow. And so we're ready to go when the PPE comes in.
Okay. Mr. Ravi, Chari, Mr. Shultz, you want to make any comments?
This is Mike Schultz.
Hey, Mr. Schultz.
Just a couple of other items of information that the group may not be aware of is that even the current testing, there is over an 8-day wait for results just because of the backlog on all the commercial labs as well as our own labs. So that's something also to remember. There is a silver lining, though, as most of my colleagues know. There has been another way of testing that just has cleared FDA, Cetafed, and it will. For example, for Tampa right now, we can only test 30 a day. With this new approved mechanism coming on, we'll be able to do close to 600 a day. And I'm sure my colleagues' health systems are in that neighborhood, if not more. So there are opportunities in the future. Unfortunately, this probably won't be ready till mid next week when we get the reagents and we verify and calibrate the machines.
Okay. Mr. Chari, anything you want to add?
I will first say, Tom, John, and Mike, I just want to say how proud I am of our 3 systems working together. We put aside a lot of our usual friendly competition during this time over the last 2 weeks. Us, as well as our teams, have been working, as John, Tommy, and Mike have mentioned, to collectively come up with a solution that we can stand together and support the county and the city as we stand this together. In HCA, we completely agree also that testing is important, and I'll invoke the same caveats that Tommy, John, and Mike have said. We have to have the adequate number of tests. I'm reluctant to believe starting and stopping with just 900 tests is appropriate. Even with the 900 tests available, we need adequate PPE to ensure that we can keep our caregivers safe. I'll echo what Dr. Holt said as well. As a community, as a society, we need to understand that we have to balance carefully the desire for mass testing against the need to preserve scarce resources for those that are most vulnerable, and that includes those that are going to be in the hospitals with the highest acuity where the challenge is. And so again, just in support of everything everybody has said, we stand ready. We want to challenge the group to understand the balance that in the fine line we're walking because of the scarcity of resources at this time. I want to thank the state for what they've helped us been able to procure from a sourcing standpoint. I want to thank the commissioner and mayor for the chance to work together. And it's been, I want to thank them for their leadership through this crisis. Thank you.
Thank you, gentlemen. We appreciate everything that you've done and everything you're bringing forward. Before I open up the questions to you, Mr. Merrill, is there anything else you'd like to say before I open up the questions?
I don't.
And me? Mr. Merrill?
No, I do not have anything else to add.
All right. Okay. Are there any questions of the CEOs of our healthcare systems? Mr. Merrill? Any questions? Any questions? Okay. We'll move on to USF School of Public Health discussions. Dr. Donna Petersen, who's the Dean of the Public Health Schools at USF, and Dr. Marissa Levine, who's a medical doctor. You're recognized to make your presentation.
Thanks, Commissioner and others on the phone. Honored to be here to provide a little bit of a perspective. This is Dean Petersen. My name is Donna Petersen. I'm Dean of the University of South Florida College of Public Health. I just want to give a bit of an overview from just a public health perspective, and then I'll turn it over to Marissa Levine, who's a professor in the college and has extensive experience in the public health system. Just to highlight a couple things that I've already heard, this is a community event that was mentioned by the emergency operations director, and it is a community event. No one is immune from this disease. It is a new novel coronavirus, which means everyone is at risk, which means our approach has to understand that and plan and respond to this idea that it is a total community event. The next thing I heard, which a number of people have echoed, is that the spirit of collaboration that we've all enjoyed is absolutely critical to our response. And this idea that we have scarce resources right now, should that resource situation change, it would be wonderful. The public would appreciate it. All of us who track disease would appreciate having widespread testing, but we do not have the capacity to do that now, as has been said a number of times. We simply do not have the resources, and those resources have to be reserved for those at highest risk. The third thing I want to say is that clearly what we're trying to do here is reduce the transmission of this virus and save lives. And the best way to do this, we have no treatment, we have no vaccine, we have no immunity. So the best way to minimize transmission of this disease is to keep people away from each other. The reason that's so important right now is that we don't know how many people are in the community right now with the virus, either with symptoms who haven't come forward yet or without symptoms. And we know, watching what's been happening in other countries and then in our own in other states, that it appears there are a lot of people not symptomatic carrying the disease, and it will take a while for us to understand the magnitude of that. Our data are therefore behind. What we know today is behind. It lags what has happened in the past week or two or three. There are people out there now, we can absolutely predict from the data we have available, there are people out there now that are infected that we don't know yet. That means that they could potentially be transmitting the virus. And so we're doing everything we can, as everyone has said, to identify cases, isolate cases, identify people who've been exposed to those cases, do our best to isolate them, but that's already behind. So I will close and I'll turn it over to Marissa Levine, that from a public health perspective, when we look at any kind of challenge like this, there are basically three ways we can respond. We can We can make people aware, we can educate them, we can give them information. And we're certainly doing that as best we can and trying to do it in a collaborative way. But in this era of media and Facebook and all of this access to the internet, people are getting lots of information from lots of different sources, and it is not consistent, and it is contradictory, and it is sometimes alarming. And there are scam artists out there, and there's a lot. So we have to contend with all of that while we try to have the most succinct, clear communications possible. We do, so that's one public health approach. The second is we try to create engineering solutions, and there just aren't any in this case. There is, we just don't have the ability, the technical ability yet to engineer a solution. And that leaves the third solution, which is to create policies that create the opportunities for people to be healthy. So in this case, policy solution to try to reduce transmission is probably where we need to go. I'm going to turn it over to Dr. Levine.
Dr. Levine, you recognize, ma'am.
Thank you, Mr. Chair. Thank you, Donna. And I'll just build on what Donna said, because we do have a lot of important decisions to make, and I will just emphasize that the spirit of collaboration and coordination is wonderful. We're in a place right now where containment of this disease is a critical piece, and that's a lot dependent upon the identification that Dr. Holt talked about and the testing that you're all looking at potentially expanding. But at the same time, we're also in a mitigation phase, so we really have to do both. We have to try to contain the disease when we know it. To Donna's point, there's significant resource limitations and also lag, which make that difficult. And then we have to mitigate it because we know it's in the community. We just don't know how extensive, but we know there's community transmission from Dr. Holt's report. So, and I think the third thing to make the mitigation efforts work is the community support that's needed to allow the policy implications and the policy efforts that Dean Petersen mentioned to work. So I see all three things as critical. And I'll just add that the mitigation piece, which is primarily totally dependent upon what we call social distancing, or maybe a better way to put it is physical distancing, because we still want people to be socially connected in some way, is critical to make sure that we don't overburden the limited resources we have. And, you know, we've all heard from the hospital CEOs, we need to be aware that as the cases rise and the severity potentially increases, those resources will need to surge, and the surge capability is limited, partly just because it's limited in general, and partly because this is a national issue, and there aren't many places to turn right now because everybody needs the same thing. I would say that we've got two important perspectives that we should consider. One is the historic perspective, and I know 102 years ago was a long time ago, but there was the influenza of 1918 that gives us some perspective because cities managed that differently and we saw different outcomes. And I think the key take home was that the cities that implemented the mitigation efforts, like our social distancing or physical distancing, the ones that implemented that early had better outcomes. And so I applaud you for doing what you did. And we're probably going to need to keep that in place for some time because historically that's been proven to make a difference. But we also know from what's happening around the globe that those places that were able to implement the policies that Dean Petersen talks about effectively have also had better results and didn't delay on them. Italy is the example of what happens when we delay. And we also need to know that places that have implemented those mitigation efforts but then loosened them up are starting to see a second wave. So we're going to have to continue our containment efforts, do the testing that we can, and not let our guard down and continue these community mitigation efforts, because right now, without treatment or without vaccination, we really have nothing else, and we want to maintain our resources. I'll just close by saying the question about whether to start a public health intervention like the testing you're talking about, when you know you have limited resources, is a really important question to consider. Sometimes we can do more harm than good by starting something that we can't continue. I think it's a matter of being transparent to the community as you're being. And if that's felt to be the best use of the resources, then go ahead. It will definitely give you some more information. But by the same point, could those tests be used other places better to meet what Dr. Holt is attempting to do by protecting our highest risk citizens and also making sure that we're dealing and identifying the clusters that he had talked about. So I'll stop there and be happy to answer any questions.
Dean Petersen and Dr. Levine, thank you so very, very much for your comments, your presentation. Are there any questions of Dean Petersen or Dr. Levine?
I have a question, Jane Castor.
Castor, you recognize.
I would ask both of them that to your comments about the need for policy to mitigate the transmission of this, do you suggest stay at home as the next step for us to take?
This is Marissa Levine. I'll jump. Go ahead, Donna.
No, you're fine.
So clearly anything we can do to keep people separated to prevent the spread is critical. But if it's a local effort as opposed to a larger scale effort, that might be limited. So I'm not sure. I guess based on the governor's comments this morning, this isn't likely to be a statewide policy. It might undermine efforts locally to do what you're talking about. I think that there's still a lot of mobility out there. People are moving around. And we know this disease is easily transmittable. So it may not be the best thing to do it in a local or regional approach only.
Well, and I'd add, this is Dean Petersen again. I think we know what we can ask people, and we know what happens when we ask nicely. We can implore them with more urgency, and we see what happens there. As Marissa has just said, there's a lot of mobility out there. Or we can direct people, and if that's what it takes to create the distancing that we need to stop the transmission of the virus so that we can focus our energies in other areas, then I think that's what we have to do. It's true that if we do it in one small community and everyone around us doesn't do it, it may reduce the impact of the effort, but it might also signal that this is important. And if we're going to actually try to control this and try to get to a point where we can utilize resources and all the things that we've been saying and try to get back to normal, that maybe others would follow suit.
This is John Couris. I don't know what the protocol is. Are we allowed to ask questions?
Sure, sir. Go ahead.
So could you talk to us, if you can, explain the San Francisco phenomenon? Because the mayor of San Francisco, if I'm not incorrect here, if I remember, they went ahead and had basically a shelter in place. The city did, and then a week or two later, the whole state went ahead and did it. If you had the opportunity to talk with folks in San Francisco, they must have looked at something and felt like putting people in a shelter in place in the city made some sense. Do you have any insight into that, or thoughts on that?
This is Jane Castor. I spoke personally with the mayor of San Francisco, the mayor of Chicago, the mayor of LA as well, and the mayor. I didn't speak to the mayor in Seattle, but she said in her list of things she wished she had done was to call for the shelter in place at the time, now stay at home earlier, that was the only way to gain control of this.
Yeah, so the health systems have talked about this. We've met on this. This was the other item that we were asked to speak to. We will do whatever the state, county, or the city wants us to do. The four health system CEOs, not epidemiologists, we're not infectious disease physicians, so neither one of us possess the expertise to opine specifically on the clinical efficacy of distancing. However, some of us had the opportunity, PGH did, to talk with some of the physicians, and I spoke with my clinical leader for this response for Tampa General, Dr. Sita Lakshmi, who's also TGH USF. When I spoke to her last night or yesterday afternoon, to get her perspective on it, her comment was, anything we can do to keep people separate, to blunt what we believe a surge could look like, is a good thing. So if the state or the county or city believes this is the right thing to do, we would, and please, my colleagues on the phone, correct me if I'm wrong, we would support the decision that was made by our community leaders.
But Mr. Couris, you asked a question, and I think that question was directed to Dean Petersen and Dr. Levine, and they never got a chance to respond. I would like to have them respond to your
Sorry,
question.
I'm sorry. I'm sorry.
No, you asked the question, but someone else answered it. I wanted to hear what they had to say.
Got it.
So this is Dean Petersen, and I think you've essentially answered your own question. The leaders in San Francisco saw that they needed to do something quickly to reduce transmission, just as the Tampa General Physician said. And they made that decision, absent a decision from the state. They made it for their community, and the state later then did the same thing. I think what Dr. Lakshmi said is absolutely true. It's what we've been saying all along here today on this call, that anything we can do to keep people apart, to blunt, I love her language, to blunt the transmission, hopefully change that curve, is a good thing. It's a good thing for the health of our community. It's a good thing to help manage the precious resources we have, which are also all of our personnel that are working to try to find cases, find contacts, find exposed folks, deal with those at highest risk. That's, we need to focus on saving lives and taking care of who we know in the community, and anything we can do to stem the tide of the transmission is a good thing. Marissa, do you want to add to that?
Yeah, I would say nobody wants to be in the situation that Italy is in right now. No healthcare system, no physician, certainly no individuals, patients, or families. This is, to Dean's point, this is a true example of the need for working together as a community, and everybody has a role and everybody has responsibility. If that policy can help make that perfectly clear, that this isn't just a policy to do because it's a nice thing to do. This is absolutely critical to assure that we use the limited resources we have to the best of our ability, and we keep people healthy, we help them get over the disease, and we lessen the potential for people to die simply because we don't have adequate resource. It could spread this out a little longer, but again, historically, and even within this current pandemic, looking at places like South Korea and even China as they clamp down, we see that they've had positive impact, and it would not be wrong to consider that.
Any other questions of Dean Petersen and Dr. Levine? Any other questions?
I have a question.
I have a question.
Whoa. I hear too many people. Who was the first one? I think who was the first one? Okay, hold on. I can't hear everybody at the same time.
Commissioner Merman wants to ask a question after her.
Commissioner Merman, you recognize.
Thank you. I just wanted to ask the healthcare providers, and I first want to say I want to thank you all because we're all going through this together, and none of us are getting a lot of sleep, and we're talking a lot, and I think the continued collaboration is going to help in the long run. What I wanted to ask you all is anybody willing to put how they feel about certain policies in writing? Like Dean Petersen, Dr. Levine. I think that's the thing. I noticed in Massachusetts when they asked the governor to do a stay in place, they had a very concerted, campaign to send letters, and they sent a lot of support letters to the governor to ask him to do that policy. And I just wonder if you all would be willing to do the same.
Addressing that,
and not that we're going to consider it today, but going forward.
Commissioner Merrill, who are you addressing that question to?
Whoever wants to answer it. Any of the hospital CEOs or Dean Petersen, Dr. Levine, yes or no? Would you sign a document or a letter to the effect of what you support and don't support?
This is the Dean, Commissioner Merman, and yes, we've been speaking out about this in every media forum we can because we think this is absolutely essential.
Okay, I think what I asked was, would you put it in writing?
And I said yes, Commissioner Merman. I said yes.
Okay, I misunderstood your response. Thank you.
Anyone else?
Commissioner Overman has a question.
Hold on. Anyone else wants to address Commissioner Merman's questions? Anyone else?
It's related to Commissioner Merman's question.
Hold on, Commissioner Overman. Hold on.
Yes.
Let me get this. Anyone else wants to address Commissioner Merman's question?
This is John Couris. This is John Couris, and I'm going to answer this, in relationship to Tampa General, but also I think where we stand as systems, because we've been pretty clear about this. We need to get direction from the county or from the city or state as to what you all want to do, and then we will support it. The other systems, and if Ravi, Mike, Tommy, you may want to add in here. They've got some real dilemmas. We're basically Tampa General's in Hillsborough primarily. We have some activity in Pasco and some activity and assets in Pinellas. These other systems have lots of employees, team members around multiple counties, so they've got a whole nother level of complexity in enforcing something like this in one county and not other counties that are surrounding Hillsborough. We believe, based on what our now flipping over to the TGH perspective, based on what Dr. Lakshmi said, Tampa General could support some sort of a stay-at-home executive order if that's what comes down. Now, putting it in writing, we can try to put something together that says that. Let me get with my team. But we can support the idea if that's what happens from the county or from the city. Guys, do you want to add anything to that?
Anyone else? Anyone else?
Thank you all. I appreciate the answers.
Commissioner Overman, you recognize.
Thank you, and thank you everyone for the offer and the information that you're offering. I think to Commissioner Merman's question and to point out the policy decisions we have to make regarding whether or not we do a stay-at-home or shelter-in-place order plays a part into what I'm hearing the medical professionals say, and then what we need to consider as our population. I recognize our governor is hesitant to do a shelter-in-place or a stay-at-home order statewide. But to the mayor of Tampa's concerns, where a majority of the workforce tends to land when you consider both Pasco, Pinellas, Manatee, and Hillsborough County, as a dense population area, we have transmission as being a major challenge. When we add up the number of cases of those 4 counties surrounding our area, where a lot of workers come into the city of Tampa, our cases are 141 based on the Florida Department of Health data. That compares to Broward County, which is clearly they have a problem, where their cases are 258, according to the Department of Health. So while I do understand, one of the things we can do is to separate people so they don't contaminate other people around them. The 2 issues we have to address is, do we want to do that, and where is the greatest need? And 2, if we were to get the kind of exposures by not doing anything that Broward and other counties that have high caseloads, it's very clear putting together a advocacy letter to request emergency need for testing equipment as well as PPEs is critical in terms of a priority and policy communication to our governor as well as at the federal level.
Okay.
So my question is, if we were to do a shelter in place, would that help until we can make those two other efforts work?
Who are you addressing that question to?
Probably our policy folks, our Donna Petersen and Melissa Levine.
Policy group, or you talk about to Dean Petersen or Dr. Levine?
Yes, either one of those.
So I'll start. This is Dean Petersen, and I think that, and I appreciate the questions, and I appreciate this conversation very much. I think that was the point that I was trying to make, that moving to a stay-at-home policy decision right now, and hopefully buys us some time to then get in place everything we need to do more testing, to take care of those who are ill, to try to isolate those who've been exposed, all the things that we've been talking about today. It allows us to focus our energies where I believe they need to be placed. Dr. Levine?
Yeah, I would add, I was listening to the governor of New York today, and he doesn't regret any of his decisions. But what I think everybody's struggling with is there a way to do this in a more targeted and localized approach? And you can only do that if you have better data. So to the dean's point, this would be an appropriate policy to implement now, realizing this is very dynamic. As we get more testing capability and we identify more about what's going on in our community at any one time, that might allow us to change or to limit the policies. But this is dynamic, and we'll be making decisions as we go along. So whatever you decide today has to be continually reevaluated as the information comes in.
Okay, I think we already led into.
Les, can I just make a quick comment about the supplies? To Commissioner Overman's question about the supplies. It's Jane Castor. To Commissioner Overman's question about the supplies, it certainly is not for a lack of trying on the part of the EOC and a number of other individuals that are making daily and sometimes several times a day calls to the state, to feds, to anyone and everyone that we can talk to, trying to get these supplies here, and they simply don't exist, and we're getting just trickle down supplies.
I think we've already led into our next topic, which Mr. Merrill is going to start off concerning the comparisons of stay-at-home orders. Mr. Merrill, you recognize.
Thank you, Mr. Chair. There's been a lot of debate and discussion about the stay-in-place or shelter-in-place approach, and we just heard that. And Mayor Castro and I thought that it would be helpful to look at some models for how that shelter-in-place might look. And so together, our city attorney, county attorney office have been looking at, I settled on 3 models, California, Illinois, and Broward County, which you'll hear from the county attorney's office in a second to describe it. But, you know, the term shelter in place, what does that mean? And the notion has kind of taken on a life of its own, and you all have gotten emails like I have that say don't shut down the county. So what you're going to hear is the common theme between these 3 models is that they rely almost exclusively on Homeland Security's definition of what are essential businesses and essential workers. And when you look at that guidance from Homeland Security, it's a very, very, very long list. So the notion that a government, a city, county declares a shelter in place and the streets are empty, is not the case at all. It also provides that people still are able to go out and get essential supplies, food, medicine, and so forth. So there are still a lot of people that are going to be circulating in the community, even with the shelter in place, because they are essential to the economy, to providing services, medical people, communications, and so forth. And that's been provided to you, and we'll go through it. So I just wanted to frame it so that we all kind of have the same common definition and starting point here. So with that, I'll turn it over to, I'm not sure who from the county attorney's office is going to do this, but I'll turn it over to that person.
Who from the
Yes.
county attorney?
Yes, good afternoon, EPG members. This is Christine Beck, the county attorney, and I have Paul Johnston with me as well. And I concur with Mr. Merrill's comments, and he did ask us to describe 3 different stay-at-home orders that have been recently issued. The first one is California, which was issued on March 19th. The second is Illinois, which was issued on March 21st. And the third one is the Broward County order, which was issued yesterday afternoon on March 22nd. And he's also correct that with these stay-at-home orders, there is and has to be many exceptions for essential personnel workers and other exemptions. I will go through each of them briefly and try to give you the fundamental differences between them. California and Illinois are similar in that both of the orders affect both individuals and businesses. Broward County's focus is on businesses, and it is also similar to a recently issued order by Miami-Dade. So starting with Broward, it was issued March 23rd. It orders non-essential businesses closed, except to the extent necessary to perform minimum basic operations. And then it lists the essential businesses, and it is a lengthy list. I think there's over 40 categories listed there of workers that would be deemed essential and not subject to the order. California is a slightly different approach. It was issued on March 19th, and it applies to individuals and businesses. It's a 2-page order which largely incorporates the federal guidelines that Mr. Merrill referenced. The federal guidelines, again, try to provide instruction about 16 categories of what are deemed essential workers. So California is very brief. In contrast, the Illinois order, which applies to individuals and businesses, it incorporates the federal guidance document, just like California, but then it goes much further and attempts to provide much more guidance. As a result, it is an 11-page order, and it puts a lot more meat on the bones, so to speak. And it breaks down 3 different categories that are considered exceptions to the order. The first would be essential activities for individuals, such as health care needs, getting supplies and food, outdoor activities, provided there is social distancing, and then taking care of others. The second category that is considered an exemption is for essential government functions, which would, of course, include first responders and emergency management, law enforcement, child protection, etc. And then the third category that is an exception is essential business operations, and that's where Illinois then pulls in the federal guidelines of the kind of businesses that would be an exception. So with that, I will stop describing them and certainly open to any questions.
Are there any questions of the county attorney, Ms. Beck? Any questions of Ms. Beck? Okay, Ms. Beck, thank you very much. There are no questions. We're now moving to discussion. Any discussion on any item that we talked about today?
Mr. Chairman, Ms. Ricklott.
Mayor Lott, you recognize.
Yes, so, this is the first time I've seen these lists, by the way, in a comparison type example. Are we going to be, how much time are we being given to be able to make comparisons? If there's items that we need to add that are unique to our community, just like what Broward did? Are we looking at, taking a week to do this, or what is your suggestion here?
For me?
Yes, I mean, I'm looking for a little bit of direction here on us composing our own list. Is this the direction we're going in?
Oh, Mayor Lott, my suggestion, and I'm not the expert on this. I don't think today we can establish either a stay-at-home order or a stay-in-shelter order immediately today. If we're going to be looking at placing one of these in order, one of these in place, I think we would need a couple of days to make sure that every entity that has been outlined, possibly in the one that was in, I think Broward County has the longest list of those exemptions. And I don't know if all of us have been getting emails. I've been bombarded with emails from different industries and different businesses wanting to be exempt. I don't think we can do that today. We may have to give, if we decide to look at putting either a stay-at-home or a shelter-in-place order in place, I think we need to give our attorneys enough time to prepare the listings, making sure every I is dotted, every T is crossed, bring that back to us, and then we make a decision as to which we need to put in place. I got some information today from Mr. Dudley, and from reading what I read, a stay-in order and a shelter-in-place are two different type of orders. One is more stringent than the other one. I think we need to take that into consideration. So I don't think we need to today say we're going to put one of them in place immediately. I think we need to have our attorneys go back and draw something up upon the direction of what we want to have them do, and bring it back to us at our Thursday meeting or our next meeting if we're going to have one next Monday.
I agree with you, Mr. Chair, and I think this is Commissioner Merman. I think that we need to also find out what the other counties are doing around us. As you know, we have a lot of commuter traffic that comes into this county, and just want to see where their heads are at going into this. And I also would like to see the medical community come to the table with more support for a policy like this, because that gives us the necessary, I think, backup information we have and data going forward. But I do think in the meantime, and I would like to entertain another motion to establish a curfew. I do think that's appropriate. And if we're going to talk about limiting activity, this would be probably the first step going forward. And so I would like to make a motion to establish a curfew, and that would be from the times of 9 p.m. to 5 a.m.
Is there a second to the motion? Is there a second to the motion? That's for lack of a second.
Commissioner Overman would like to speak, please.
Commissioner Overman, you recognize.
Thank you. To Commissioner's request for a curfew, I'm concerned that that will not accomplish what we're trying to accomplish, because it's only limited hours, and it's critical if those hours are put into place. It limits the ability of stores to get restocked, resources to get to where they need to be in the morning, feeding our children in the mornings. You know, those are going to be problematic. But I'm going to move to categorize the essential services list as defined by the CISA, or the Homeland Security list, that our legal team and that our legal team poll each member for input to narrow the list as appropriate to our county, and come back with a order to consider on Thursday. I do not believe we have the time to wait, given we don't have the testing materials or the PPEs to protect our medical equipment and our first responders. So I move that to categorize essential services as defined by the CISA, but to ask our legal team to poll each member for their input to narrow or expand the list as appropriate as it pertains to Hillsborough County.
Is there a second to the motion? Is there a second to the motion? Motion dies for lack of a second.
Mr. Chair, this is Commissioner Merman again. Don't we have to give direction to our county attorney's office by way of a motion to even get them to work on any kind of a stay in place or whatever, action we want to take going forward? And of course, essential services would be a part of that, and they would look over between the different states and counties, and through our input, they would. But isn't that where we need to go, is to give them direction? That would be our next step.
That's what I said when Merrill asked me the question. I may not have said a motion, but I meant that if we're going to give our county attorneys any direction, it has to be in form of a motion and clarify what we want them to look at and bring back to us on a certain date and time.
Okay, thanks.
This is Mayor Castor. May I speak, Commissioner Miller?
Yes.
The county attorneys and the city attorneys have worked on this issue all weekend long, and they have the outline that is very simple to follow. It includes all of those HHS exempt 16 categories that have a number for CISA, Homeland Security. It has 16 categories with a number of different essential businesses and employment named in there. And this is not an onerous or oppressive. Basically, what we're asking is just people to stay at home so that they don't pass this virus to others, and we'll be able to flatten that curve. So all of the work has been done by other states, and then the county attorney's office working in cooperation with the city attorney's office. So I believe that we should make those documents available. You know how I feel about the urgency of this. Each day that it's delayed, more individuals are being infected out there. So I would ask that we circulate this document that all of the attorneys have been working on, and let each of the members digest that, and then have a time certain for us to come back and discuss it. Thank you.
Is that your motion?
Yes, sir. That's my motion.
Is there a second?
I'll second that.
Who was that?
Commissioner Overman will second that.
The motion by Mayor Castor, second by Commissioner Overman. Is there any discussion on the motion?
Mr. Chairman?
This
is Andy Ross.
Mayor Ross, you recognize.
Thank you. Two things occur to me, and I'm certainly open to the idea of looking at what the attorneys have drafted. I don't think it ever hurts to take a look at it and for us to have discussion about everything. But one thing that kind of occurs to me here is that I fear that our Hillsborough County EPG group is kind of doing on a larger scale the very thing that the reason the group exists to prevent in the first place, and that is each of us acting in isolation from one another. In other words, the purpose behind this group is so that Temple Terrace doesn't do things that the county doesn't do, and Plant City and Tampa, so that we're all consistent. And my concern is that we are in Hillsborough County doing the very same thing on a little larger scale, that we're getting. This is something that, I mean, I'm all about home rule, but some things are rightfully deferred to the state, because it's, as we heard from our healthcare professionals, it has some limited impact if we do it on a small scale, but to truly be effective, this has to be something done on a larger scale, statewide. And so, I'm willing to look at it, and I'm open-minded, and I don't, I take a look at and see what the exceptions are and so forth, but I fear that we're doing the same thing on a county level that caution against each of us doing individually, and that is acting in isolation from others. And truthfully, and I know our city is much smaller than some of the other jurisdictions, but there's really, as I go out in our community now, there's nowhere to go anyway. I mean, the churches are closed, the restaurants are closed, everything is closed. And the only people I see out are going to the grocery stores and the pharmacy, and those would still be exceptions. So I question what real impact this is going to have, because nobody's going anywhere anyway, except to one of those places that's going to be exempted anyhow. But again, I'll keep an open eye on that. I just want to make sure we're not doing the same thing that our very existence is to prevent. Thank you.
Okay. Any other comments on the motion?
I would just, one more comment here from Mayor Castor.
Who's speaking?
Mayor Castor. St. Pete and Pinellas County are discussing the very same draft as we speak. So hopefully it will be more of a regional. And to the comment earlier about doing it in small scale, our county is the size of some states. So, 1.4 million, I don't think is a small scale. And if we can get Pinellas to jump in as well, then we'll be able to prevent that many more of these cases. Thank you.
Okay. May I ask a question?
Mr. Merrill, you recognize.
Thank you, Mr. Chair. First, I guess I was a little surprised that we were working on a policy without the policy group knowing about it. I think there wasn't specific direction giving, especially to our county attorney, to do something like that with the city attorney. So, and I really want, part of the analysis, I want our economic staff and development staff to weigh in, and our Couris store staff to weigh in, so that people can see what the impact of this is going to be on our 1.5 million people, because they are experiencing record numbers of people filing for unemployment right now. The lines, the national lines have already experienced overload issues. And I just want everybody to, I think we need to understand, I agree with the Vice Mayor of Temple Terrace that I understand to protect. I didn't see the healthcare professionals willing to step up, except for one, and Dr. Holt has not opined, to step up and really sign documents saying that they support this and our economic benefit. Plus we have, the exempt businesses. So I think there's a lot of areas that need to be explored before we really dive into the deep end of this pool, and that really affects a lot of our residents, because like you, I am going through my 500 emails right now of people that don't support this, and I'm not sure. We have to weigh things carefully. We've got to have a targeted approach. And I think that we're doing a lot, like the vice mayor from Temple Terrace said. Nobody is really out. I brought up the curfew because I think our kids still want to leave the house. In fact, most parents said, please do the curfew because my kids want to get out of the house. But we do not want to overwhelm anymore a system that is very fragile right now, and that's our economic system, our healthcare system. And I was unaware that these policies were really underway, and I don't even have any outline of a policy in front of me. I comment.
Mr. Chair, this is Mike Merrill. Could I just respond to that, please?
Mel?
Yeah, Commissioner Merman, I just want to be sure that that it's clear that we have not embarked on developing any policies. What's been happening is there's been a conversation going on in the community that is spinning out of control about stay in place, shelter in place, whatever it is, shutting down the county. When I talked to Commissioner Miller, I said, we need to bring this into a forum where we can set the record straight about what we're talking about and provide enough facts for the EPG to make a decision. To do that, we needed to have the attorneys find some templates that we could present to you for discussion. We have not been developing policy. We are not drafting ordinances. We are not drafting orders. So I just want to be clear. I don't want to be sure Christine is probably like, very, very uptight right now, but she did not do anything wrong. This was something that I felt was necessary to get in front of the group. We haven't started any machinery to develop any orders at this point. We'll take direction.
Thank you for the clarification. I guess what I did is I misunderstood what Mayor Castor said.
I had two people talking at the same time.
Yes.
Mr. Merrill, you were saying something?
No, I said I really appreciate the clarification because I must have misunderstood what Mayor Castor said, that the city and the county attorneys were working over the weekend, and generally that means to me that they're kind of putting something together. So thank you for the clarification.
Can I add in? Can I add one clarification, please?
Who's speaking, sir? Who's speaking?
That's John Couris from Tampa General.
Sir.
I do think it's just very important. I appreciate. I was just a clarification on what Commissioner Merman was saying. The four health systems' position on this is that we are going to support what the county and or city or state decides to do. We need to be very clear with that. Other thing that we were asked to do yesterday was to talk with our clinicians, scientists, researchers around their position on not so much the policy of stay at home, but what their feeling is related to keeping people away from each other. And it goes back to this is where it's a TGH specific response, and because we were asked to go back to our respective organizations and do some work around that. Dr. Lakshmi's response to me was anything that we can do to blunt the surge is a good thing to do. And if the county or city decides social distancing is what they want, a stay-at-home order is what they want to do, we can get behind that order. I want to be very clear here with that. So from our perspective, that would make sense if that was the decision that was made by the county, and the four systems would stand behind that decision.
Thank you, John.
Commissioner Miller, this is Christine. May I clarify quickly?
Ms. Beck, you recognize.
Thank you, Commissioner. And I just want to emphasize that the county attorney's office has not drafted any orders whatsoever. We were directed to research and provide support by trying to understand the different methodologies out there for the orders. Most local government attorneys are generally following what's going on in other communities to be prepared, but there has been no drafting by our office whatsoever.
Basically saying.
Okay, let me ask you a question then. If there's no drafting, the document that the mayor is talking about, where did it come from?
That was provided by the city attorney.
The attorney's office created that, and it was shared with the county attorney's office in the spirit of cooperation.
So, Ms. Beck, you had an opportunity to review it?
I was provided it at midnight the other night, and I immediately forwarded it to Mr. Merrill just for informational purposes.
All right, we have a motion on the floor by Mayor Castor, second by Commissioner Overman. Is there any further discussion on the motion?
I do have
I'd like
some
to make
questions.
one statement.
Pardon me?
Mr. Chairman.
Yes, Mayor Lott.
I have to agree with some of my colleagues here, where until we can even start placing the idea that we're going to have a stay-at-home policy in place in the county, I couldn't support that until we look at all the facts, not just the medical facts, but the facts from our sheriff, which I haven't quite had a chance to hear from him yet today, as well as our three chiefs or my three cities, and the enforcement. Like, if we put this policy in place, how do we enforce it? What are we going to do? Are we arresting people? Are we Are we just giving them a citation? What's the enforcement of it? The second thing is that I want to agree with our Vice Mayor, Temple Terrace, is that, just like the medical experts that spoke earlier, the actions that we have already taken in just a short period of time has already had amazing results for limiting the amount of interaction going on in our communities and cities. As you can tell, our traffic is down. The lines in the drive-through lanes are down. I mean, people are using good caution. Maybe not 100% of society, but our great citizens and our good citizens, they're exercising good caution. And I think the policy we have in place is already working. But I would also want for us to spend the proper time to make sure that we don't leave out some groups in some type of order like this to where it has an effect that we're not anticipating. And the biggest point I want to make is this: I still believe that we need to stick behind the governor in this particular call. I don't understand how someone can be driving from Holt County to Hillsborough County and not know if they're violating a code, or they violating a policy, or if they're in Plant City or Temple Terrace and driving into Tampa, or am I now violating a certain code or policy? We have to stick with what you said earlier, Mr. Chairman, is that we have to be one voice. And when we're not longer one voice, we are definitely going to have chaos in our community. So I will not be voting for this motion. Thank you.
Is there anyone else concerning the motion by Commissioner Castor? I'm sorry, Mayor Castor.
Commissioner Miller.
Yes, who is this?
Commissioner Miller, this is Melissa Snively from the school board. May I speak?
Yes, ma'am, you recognize.
Thank you, sir. I would have to concur with some of my colleagues as well. Vice Mayor from Temple Terrace, Mayor Lott, Commissioner Merman. I definitely have some concerns about examining all of the data that's available and what kind of impact this has, not just to our educational community, but also to the community in general, our parents, our families, our employers, our employees. And I also am concerned about the enforcement of this and what type of resources will be strained based on this type of action. And in addition to that, there are a lot of details that I'd like to see about our communication strategy, a logistical strategy, our medical resources. I think without a thoughtful plan in place, then it wouldn't be prudent to move forward with something like this. I would actually reconsider Commissioner Merman's motion about the curfew, because I do have some concerns with our youth, our young adults being out, because they seem to be the ones who are less concerned, I will say, with the transmission of this particular illness. And that's just my observation from what I have seen in parts of the communities across Hillsborough. But I have to agree that I think that we don't have enough data, and I also believe that maybe more resources would be available if we let our state execute this, our governor execute this order versus locally. Maybe we would be able to have more medical resources, more test kits, and then we could take a different approach to this, like a case-based intervention approach, as opposed to just a widespread approach without a strategy. Those are my comments. At this time, I cannot support this motion.
Okay, is there any other discussion on the motion by Commissioner Castor, Mayor Castor, second by Commissioner Overman?
I do.
Hold up. I'm hearing too many people at the same time. Who's someone?
Mayor Castor.
Yeah, and then Commissioner Merman.
Okay.
Okay.
Castor, you recognize.
Well, my understanding, and you can ask Sheriff Chronister about this, that law enforcement from all 4 jurisdictions have had a conversation about this, that at how it will be implemented. It's, as I said, it isn't going to be as onerous as putting a curfew in place. This is asking individuals to stay inside. Actually, it's an order, but asking individuals to stay inside, stay away from each other. There are exemptions for all essential businesses, again, that cover 16 different categories. And if we continue to put off for more information, more individuals are going to get this virus. We are already trending ahead of Italy at this point. And if we're going to wait on the governor, he clearly has no intention calling for any statewide action. So, and he said that in the media. So we need to make a decision as a location with 1.4 million individuals here that is going to save lives. We have the ability to put this in place. Law enforcement has dealt with many issues. Communication, we can talk to all the radio stations, get all of that information out, get individuals from the neighborhood, the matriarchs, the leaders in the neighborhood to slow roll and socialize this process into place. We don't have the ability to test. We have no idea how many people are walking around with this. We've already gotten spring break individuals that are starting to test positive. And the longer we wait, the more people that are going to get infected. And we were all elected to do the right thing, to stand up and do the right thing. And this is the right thing to do. The more we kick this issue down the road, the more people are going to die in our community.
Mr. Merrill, you recognize.
Mr. Miller, I also would like to speak after Merrill, please.
Mr. Merrill, you recognize.
Thank you, Mr. Chair, and I appreciate everybody's thoughts. I think this is a great conversation we're having, and certainly we're going to get to a good place to help protect our citizens. The sheriff has not spoken, and I don't actually want to put him on the spot, but I will. Does he have any thoughts going forward? And then I have a follow-up substitute motion.
Sheriff Cronister, you want to say anything at all, sir? You're not compelled to.
Yes, sir. I think like everybody, I was hoping that the medical information provided would give us better direction and clarity to which direction we should go. While this health emergency has public safety implications, I want people to know that law enforcement, if this group decides to move forward with such a policy, will enforce the directives and decisions of this group. It is important to me and law enforcement that any health, travel, work restrictions put in place be clear and understandable to everyone in our county, where people can go, what people can do, need to be crystal clear to our citizens. That will be the best way to assist our patrol officers and deputies in making law enforcement decisions. Now, after speaking to my colleagues, there is several concerns about the enforcement of this with the additional burden of being out and having such a robust law enforcement presence at shopping centers, grocery stores, places where we've been notified of areas of concern. But at the end of the day, I think the best way to enforce any decision or directive is to count on the personal responsibility of every person in our community. This is not merely a law enforcement issue. We're going to need everyone's help, Mr. Chair.
Thank you, Sheriff. Commissioner Overman, you recognize.
Oh, I wanted time to make a substitute motion.
Mr. Merrill, you weren't done. Okay, Commissioner Merrill, you recognize.
Thank you. Since Ms. Snively gave that comment, I'd like to make a substitute motion to establish the curfew and to also direct our county attorneys to work with all the other county attorneys from the other municipalities and the sheriff and law enforcement to work on a policy that we will review at a later time for a stay-at-home.
I would second that motion.
There's a substitute motion by Commissioner Merrill, second by School Board Chair Snively. Commissioner Overman to the
I'll
substitute
speak to the motion.
Pardon?
I'll speak to the substitute motion.
Okay, you recognize.
Thank you. Just to clarify, at the meeting last Thursday, I asked our county attorney, Paul Johnston, to begin reviewing the various different definitions of essential services so that if we got to the place where we were going to consider a stay-at-home or shelter-in-place or even curfew, that we would have the language to consider either an order or an ordinance or any of the above that we're discussing today. I got the various different sample languages at 1:05 today. So to be fair to all of those that are concerned about where we're going and what we're considering approving, all of those documents have the various different levels of complexity, and communicating that going forward is going to be important. So I will support the motion because it does include instructions to our attorneys, and clarify this if I'm incorrect, it does include directing our attorneys collaboratively to begin bringing back language that would include a shelter in place and provisions for curfew of our youth, where we just also have a clear definition of essential services so that our businesses know how and when they should act responsibly.
You're trying to restate the motion. I'm gonna ask the maker to restate the motion. Is that what you're trying to do?
No, I was just clarifying what I think the motion included.
For the clarifying, let's ask the maker of the motion what she said. Commissioner Merrill, restate your motion. Mr. Merrill?
Sorry, I have my phone on mute. No, I think she was clarifying, and that's exactly the intent, that any policy going forward on either shelter in place or stay at home would include exempt businesses. Absolutely, especially our construction workers, our builders, and our pharmacies, our healthcare individuals, all those people. And yes, we would have to, they would seek input from us.
Let me restate this. Restate it different. Remember, Commissioner Merrill, restate your motion.
Okay, it would be to establish a curfew from 9 p.m. to 5 a.m. And I'm going to restate the motion.
That's what I asked.
To establish a curfew from 10 p.m. to 5 a.m. because I'm recognizing the fact that some people don't get off work till 9 or 10, and that the county attorneys for the county and the municipalities, the sheriff and law enforcement and emergency management operations would develop a policy on either shelter in place or stay at home or both that would come back to our policy group at a future time. And of course, included in that would be exempt businesses, and they will consult with each member of the policy group on who those exempt businesses would be, what those would be.
Okay. We have a clarification and restated the substitute motion by Commissioner Merrill, second by School Board Chair Snively. Is there any further discussion on the substitute motion? Any further discussion on the substitute motion?
Mayor Castor, I want to make a comment.
You recognize that?
I disagree with the curfew because that is much, much more onerous than the stay at home. So individuals now between those hours, if they needed to go out for food or they got off work, they couldn't stop. The stay at home is much less onerous and much easier for law enforcement to enforce than a curfew is.
Commissioner Hill?
Yes, who's this?
This is Andy Ross.
Yes, Mayor Ross.
In my opinion, these are two very different things that deserve separate discussion. A curfew is one thing, and we would, in my opinion, would deserve discussion about what types of activity and people would be exempt from that. And the second thing is a stay-at-home order, which would be really a very different discussion about who's exempt from that and for what reasons and so forth. So I'm kind of opposed to the motion just simply because I think we've got two very different things included in the same motion.
Okay. Is there any other discussion on the motion, the substitute motion by Commissioner Merrill, second by School Board Member Snively? Any further discussion?
Well, Mr. Chair, can I make a closing remark?
Yes, ma'am.
Okay, So I understand what Mr. Ross said. I was trying to be, I guess, collaborative with Mayor Castor in including that policy, and it is just to bring a policy back. It's not to make any policy right now, but just to bring back language for future discussion. So I don't think, yes, they are two different things, but maybe I should withdraw the substitute, make a new substitute to have the county attorney for all the municipalities to bring back policies for.
Commissioner Merman? Commissioner Merman? Is everyone still there?
I'm still here.
Yeah.
I'm still here.
Commissioner Merman,
Yeah, I'm raising my hand.
Okay, Commissioner Merman.
Okay, so I understand what he's saying, and I would like to get support. So, we're going to meet on another call on Thursday. So I'd like to withdraw my substitute and have a new substitute that would, if it's okay with Ms. Snively, who was my second, that the county attorneys would bring back policies for a curfew and for, and at a later date, bring back policies for stay-at-home or shelter or stay-at-home or shelter-in-place. Stay-at-home, shelter-in-place policies at a later date, and that will be my new substitute.
Is there a second?
I'm amenable to that substitute motion. This is Marissa J.
Okay. Let me get a clarification, Commissioner Merman. You want at our next meeting, the county attorney, whoever you said, to bring back the curfew language? Am I correct?
Yes.
Is that what you're saying?
Yes.
And at
yes.
a later date, a later meeting to be identified to bring back a stay-at-home language? Is that what you're saying?
Correct.
Is there any other discussion on the new substitute motion? Any other discussion?
Mayor Castor again.
Castor,
I disagree with that, to push off the stay-at-home order, that needs to be brought forward this Thursday too. Again, the further we kick this down, the more people that are going to get this and the more people that are going to die.
Any other discussion on the substitute motion by Commissioner Merman, second by Ms. Snively? Any other discussion?
This is Commissioner Overman.
Mr. Overman, you recognize. Mr. Overman, you recognize.
Okay, I do understand. Thank you, Chair. I do understand what Commissioner Merman and Snively are trying to accomplish. They want a curfew, and I believe that might address the sheriff's comments regarding children out at night and the children's situation. So, but I also understand Mayor Castor's concern about pushing it off down the road. So if the motion did include that both those documents, maybe separately, so they can be voted on separately at next Thursday's policy meeting for consideration by the policy committee is part of the motion, I would just support it. Otherwise, pushing it down the road, I would not be.
That's not what the substitute motion said. The substitute motion said bring back this coming Thursday a policy on curfew, and at a later date bring back one on stay at home. That's what the substitute motion said.
That's my point. I would like to see both of those happen this Thursday, rather than push off the stay-at-home policy to at a later date.
All right. Well, that's not what the motion says, so I'm just letting you know what it said. So, is there any other discussion on the motion?
Mayor Castor, I would like to ask if Commissioner Merman would amend her motion to have them both brought back next Thursday.
Mr. Merman?
This Thursday.
I think the work on the stay at home and shelter in place are going to require a lot more research and investigation because of all the things that everybody has talked about here, from Mayor Lott, the Vice Mayor, Ross from Temple Chairs, all the comments that have been made at the table today. And I really don't want to rush it. I'll be honest with you. I'm not kicking the can down the road, but it's got to be right. This is an important policy. As I see it from my research, the only difference from where we are now and a shelter in place or stay at home is that we're shutting down businesses. And so I just want to make sure that this is the right direction for us to go in. You know, we'll discuss it probably next Monday, I would think, because they'll give them enough time to get all of our information.
Is there any other discussion on the substitute motion? Any other discussion on the substitute motion? Roll call vote, please.
All right. Miller?
Yes.
Overman?
No.
Herman?
Yes.
Cronister?
Yes.
Castor?
No.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
All right. Motion passed 6-2. Commissioner Overman and Mayor Castor voted no.
Okay, so that's where we are at just a point in time. Is there any other discussion or actions we need to take at this point?
This is Commissioner Overman.
Pardon me?
This is Commissioner Overman. May I make a comment?
Yes, ma'am.
What I think I just heard is people are very interested in both issues. So I'm going to make a recommendation, not a motion, but I'm going to make a recommendation. At 1:05, the policy committee was sent language from Broward County, Illinois shelter, California shelter in place language to review so that we could have this conversation. I urge each of our policy committee members to review those documents very carefully and to collaborate with our legal teams to help assist in moving towards some documents. And if it could be brought back, Thursday, great. Because I think what I heard from our healthcare professionals and healthcare policy professionals is that anything we can do to help distance people and have clear and communications on who are the essential services that are permitted to continue doing business safely is the best course of action going forward. So I would just, if there's a way to bring something back very quickly, I'd like to urge that work to be done. As I asked our attorney, Paul Johnson, last week to bring the essential services language to our committee for consideration. We're not shutting businesses down with a shelter in place or a stay home. We're asking businesses to do everything they possibly can to keep not only their employees safe, but also our citizens safe by adopting policies that require cross-contamination minimization.
Okay, I think we understand what's in each and every one of them.
Thank you, Chair.
Any other discussion we need to have at this meeting? Remember what I read at the beginning, ladies and gentlemen. We got to have coordination, collaboration, and communication if we're going to succeed. If we don't, we're going to have chaos at its best. I believe we have another meeting scheduled for Thursday at 1:30.
Excuse me, Commissioner?
Yes, who's speaking?
This is Tommy Inzina with BayCare Health System. There was a lot of discussion earlier around the testing but I didn't hear
Yeah, you're
you
right.
all give us any direction
You
on
did
that
not.
issue. There was a lot of discussion and it went away. Can we get some clarity as to what you would like us to do or not do on that?
Absolutely correct, sir. We did not. We did not. We did not give any clarity to the CEOs of our healthcare systems as to what we want to have done with the testing. At this point, I think we need to give them some direction as to what we need to have done. Anyone wants to speak on that? Anyone?
Can you say that again? I think I missed half of it.
We have not given any direction to our healthcare system CEOs concerning the testing. We did not tell them what we wanted to have done. If we wanted to have the testing at a site, if we want to have it at any other recommendations, we have not given them anything. And right now, they don't know what to do.
I think that, oh, never mind. I just think that we need to, our committee needs to do an all-out blitz to the governor's office and get whatever kits are coming in.
Mr. Chair, if I could just maybe clarify.
Sorry, who's this, Mr. Merrill?
This is Mike Merrill. I think, what they're asking for is we had talked about the choice between moving forward with the Raymond James site and the 900 kits, which will be exhausted very quickly. So we'll start up the site, and then assuming we don't get any more kits this week, it'll be shut down pretty quickly. That serves a particular need to get more data. So the other choice is to not stand up the Raymond James site and instead use the 900 kits for what Dr. Holt and others have described as the higher risk and more acute patients. So that's the choice that they're asking us to make here.
Let me say so. My concern is this, and if I'm not missing anything, we do not have the PPEs at this particular point in time. Am I correct?
Well,
Mike, where are we with that?
Well, we checked this morning, and it's supposedly en route. But so if we get it tomorrow, so first of all, I'm not sure how many units of PPE we're getting, but let's assume it's sufficient to handle the 900. If we get it by tomorrow, then we're ready to open on Wednesday and basically blow through the 900 kits as quickly as we can. If we don't get any by tomorrow, we'll just have to, when we get them, we'll be ready to open, I guess is what I'm saying.
Okay. We may get them. We may get them by tomorrow. We may get them by Wednesday. We may not get them at all.
I think we'll get them. I mean, we've been told they're on their way, so it's.
Okay, I think somebody's trying to. Yes.
This is John Couris from Tampa General Hospital. If we are getting PPE and it's en route, and we just don't know if it's going to be here tomorrow or Wednesday, we have 900 kits, I think, and maybe a couple hundred more that people have. I heard yesterday that we might have, so it might be 1,000 to 1,100. I think if we're getting the PPE and our teams have worked hard at putting together this site, I go back to what Tommy said earlier. It's 900 people that have been tested in the community, which is a good thing. And I think it's something that we have to do if we get the PPE along with the kits. Our teams have worked hard over the last week. That's not the reason to do it. The reason to do it is we're going to test 900 to 1,000 people. I think we should do that, because if we've learned anything around the world, those that did test but tested early, admittedly, were able to do a better job at containing this. So I think we have a responsibility to fulfill at least the 900 if we have the PPE.
Miller, this is Melissa Snively.
Yes, ma'am.
Does the direction that we need to give require a motion?
I think to solidify it, yes, ma'am, we need a motion.
Okay, so that we can continue our discussion, I would like to make a motion that we
go ahead, if the stadium is ready Wednesday, to test, to use the test kits that are available, that we go ahead and move forward so that we can go ahead and test more individuals and collect more data for the benefit of the residents here in Hillsborough County.
Okay. This is Amy.
I'll second that.
However, let me say this, Ms. Dudley, would you please add into your motion only if the PPEs come in?
Yes, with that exception, only if the PPEs come in for that resource.
Okay. There's a motion.
I'll second that.
Who is that?
Rick Lott.
Okay, all right. We have a motion by School Board Chair Snively, second by Mayor Lott. Is there any further discussion on the motion, sir?
Good, I'm in the.
I have a question.
With our task force.
Somebody to put their phone on mute. Who wanted to ask a question?
I have a question.
Who is it?
This is Commissioner Overman. Has a question, please.
Yes, ma'am, you recognize.
This is a question to our medical professionals. For the benefit of doing 900 tests, what is the manpower required by our healthcare system to staff once those PPEs come in? And do you believe there is a benefit if testing is available at each of your facilities?
Who wants to answer that question?
This is Tommy Inzina with BayCare. I'll answer it. I can't quote the exact numbers, but our teams have worked through with the city and the county all the logistics. We're prepared to provide the clinical staffing to do this, with the city and the county providing some logistics support. It's generally depending on the model you use, and the model BayCare uses now, we'll have one station where someone is screening to see if the person is eligible for testing. In this model, we may not need that if that's done through the triage line. And then there's a couple of more people in line as they swab them. So it's typically a handful of people, not 30. And the reason why we do support this outside, we do have testing at the hospitals, but we have tremendous risk of spread if people in the community who are not sick enough to be admitted to the hospital, if they're presenting to the emergency departments, that creates another set of problems. So the details on the staffing have been worked out by our teams, and we've agreed to provide the staffing to do that.
Thank you for your answer. And so when you describe the triage process, those that are listening to this, that means they've been pre-screened before they actually get in their car and drive to Raymond James?
Mike, would you address that, Mike Merrill? Because I think you guys have looked at that part of it, right?
Yes, that's correct. We're using the county's call center line, which is going to be staffed by medical professionals to do the screening. And once the person is screened on the call center line, they are given a number or some designation and told they can go to the site. They present that boarding pass, or whatever you want to call it, and they're in.
Okay, so for the public's benefit, that it happens to be listening to this, and it's a large number. So they need to call the hotline to get pre-screened before they actually drive to Raymond James. Is that correct?
That's correct. And that'll be announced through a combined, concerted outreach effort and advertising.
Okay, great. So there should not technically be anyone that drives up to Raymond James to get a test that has not already been pre-cleared and is exhibiting a series of symptoms that would suggest that testing should be done.
Yes, this is Tommy Inzina again. Just to give you a perspective, because we BayCare don't have the technology that Mr. Merrill has put in place, what we've been doing is screening them as they presented. And to give you the numbers, we've seen 6,600 people. 2,800 of them were turned away because they didn't meet the criteria. We tested 3,800 people. So pre-screening them in advance, if that works, will make this work much smoother. But that would be the intent.
And we do something similar at TGH right now. It's a little bit different but similar to that. That would be the same thing we would do at Raymond James, and the teams have worked hard at getting all those pieces in place.
Okay, we have a motion by School Board Chair Snively, second by Plant City Mayor Lott. Seeing no further discussion, please call the roll call.
Miller?
Yes.
Overman?
Yes.
Herman?
Yes.
Cronister?
Yes.
Castor?
Yes.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
All right, motion carried 8-0.
Okay, motion passes, sir. CEOs, you've given your directions, sir. Okay.
Thank you for that.
Okay. Is there any other business to come before us today?
Commissioner Miller, I'd like to just make a final comment. I understand the motion, because I made the motion that was made. Nothing in that motion said we were not going to enact policies in the future about stay at home or shelter in place. And I think the community sees the vote as maybe pushing it down the road, but it's not. It's getting the policy right and making sure we have all the research and data to support that decision. And I think it's important that we make that statement to the community and that we have the right health care, that we have a lot of health care support to any decision we make going forward. So I just wanted to make that statement.
Okay. Thank you, Commissioner Merriman. Let me bring another thing forward too before we go. To the county attorneys are going to be looking at the curfew. One of the things that has come to my mind is that our transit system buses will be running past that curfew hour, and many of those buses have to go back to the lot on 21st Street. So therefore, I know sometimes if someone's going to, maybe law enforcement want to know why they're out that late, I would ask that you put in the language that they will be in uniform, and if they show their badge and show they're a hard employee dropping a bus off, that they be, I don't know what the word is, excused, looked over, whatever the case may be, because we're going to have our buses continuously running past those hours because people have to get home. So please put that in there.
Mr. Chairman, Rick Lott.
Yes, sir. Yes, Mayor Lott.
Okay, just so I'm understanding what your comment was there, the language in the motion that was made earlier, that was for minors only, right, for the curfew?
I don't think so, was it?
No.
That was for, okay.
That wasn't for minors only, no, sir. Okay. You okay, Mayor Lott?
Well, all the discussion was that I thought the curfew was about was the issue with the minors from school and so forth hanging out, and it was addressed several times, and so I thought that was included in that motion. But I guess we will deal with that later on. Thank you.
Okay. All right. Any other discussion before we adjourn? We have
I have a
another.
question, please.
Yes, ma'am. Who's this? Mayor Castor?
No, this is Commissioner Overman.
Mr. Overman, you're recognized.
Thank you. I'd like to make a motion to ask for a report at the next meeting for a treatment plan from our, in case hospitals get overwhelmed. If we get to a situation where the spread is faster than we anticipate or have realized, I'd love to hear from the medical community what their plan looks like or what their capacity looks like in the event that we see a major outbreak.
I think they may. Are you all able to address that now?
I can. My name is Mike Merrill. We have together with Department of Health, because we wanted to be sure we had their specifications. And working with Bob Morrison, who is the executive director of the Hotel Motel Association, we have identified hotel properties that fit the bill. We've got lease agreements. We're negotiating, and we'll be able to get those ready to go. I can't give you a specific date, but soon. And I know the city is doing the same, and we are communicating together about that. So we will have, I can't give you the number right off the top of my head, but we'll have a significant number of rooms that meet DOH's requirements, and have them as backup facilities both for ALFs and for hospitals, and generally for those who require some sort of quarantine or isolation.
Okay, that does answer part of my question. But if that is our plan, the medical professionals in our community will have to actually staff those alternative medical facilities or medical resources. And so I'm curious how that will work with our hospitals and medical professionals.
Well, so that's part of the effort. Jean Early is leading it, and we can bring that specifics. We can bring specifics back to you if you like. We can as soon as we can bring back Thursday if you like. And yeah, but I mean to just kind of cut to the chase. If a hospital has a need to move patients, or an ALF has an opportunity to move, or has a need to move patients, you know, they're going to have to provide the care for those patients. I mean, we don't have medical professionals at the county or as a city. So, I mean, we're providing the space, and if they want to use it, that's what we're doing to coordinate this effort, that they'll have to provide the staffing, and that just makes sense. It's their patients.
Okay. If there's nothing else to be brought forth at this point in time, we'll stand adjourned. Remember, we have another virtual meeting on this coming Thursday at 1:30 p.m. A call-in information will be provided to you all by staff. Everyone, take care. Thank you for your input. Be safe. Bye-bye.